Welcome, everybody. This is season 5, episode 1 of Love Plants. I am so excited to, be reaching season 5 of this exciting journey, and also to be chatting today with board-certified allergist and pediatrician, Dr. Farah Khan. And we'll be chatting about food allergies, which I know is one of your, passions to to talk about this and explain the nuance, and focus a lot on the nuance as well. So thank you so much for being here.
I'm excited.
Yeah, I'm very excited. I'm gonna drop your, bio in the caption so that people can learn more about you. And of course, we'll discuss towards the end of how people can reach out to you if they have questions and follow the work that you do. But I wanted to start by asking you what prompted you to become a physician and to follow this path of, allergy, and also why it is important to you to do this medical science communication that you do on social media.
Yeah, I think the in a nutshell, I wanted to become a doctor to help people. I think when you strip out all the other layers, that's why a lot of us go into medicine, right? It's
Mhm.
not, oh, I want to make a bunch of money. Like that's not why you go into medicine.
Yeah.
It really is to help people. And I think what I realized over the last few years is so my background is in journalism. And I did a lot of healthcare economics and things like that when I was in graduate school, and getting training with the journalism program at Northwestern University. And then I realized, I had to put that on pause while I was in medical training because med school and residency and fellowship was really demanding, and I just didn't have the time or space to keep up with those skills. But then, as an attending, now that I'm done with training over the last few years, I was like, man, there is so much stuff that needs to happen even outside of my exam room and outside of my clinic space. And so I wanted to figure out how I could reach more people. And then I remembered that I have this skill set. That's really just what happened. I was like, wait, I can tap into my journalism background to be able to take sometimes very complicated and
Mhm.
nuanced medical topics and then be able to communicate that to a larger population. I think is a different and unique skill set. I'm still working at it. I'm not 100% perfect. It's evolving, but I think that's also what I love about it is that I'm also changing depending on like the feedback that I'm getting or the
Right.
questions that I'm getting from parents and patients that have found me online. So,
Yeah, yeah, and that is fantastic, and that actually it's actually a wonderful combination because you can kind of distill the information that will be useful, and also explain kind of the complicated matter in a more simplified way. But we're all learning, like you see that science
yeah.
communication, the field is changing every day,
Hmm.
and the way we approach things and the way people respond, which is
Hmm.
what I think I also like about this is that it's a two-way communication, because also the people who receive this information kind of drive the way that we explain the information to them.
Yeah, absolutely. And
Yeah.
even within like science communicators, like we have like some really great people that are public health policy experts, right? But they're not necessarily at the bedside, just the same way that the physician is at the bedside, but not
Mhm.
necessarily, we don't always understand all of the intricacies and the bureaucratic layers, right? And so you need all of these peoples, or like the dietitian who's helping me manage a patient who's avoiding some really big food groups. Like everybody has their own unique skill set. So it's not a matter of like, I think that's the one thing that I'm sort of struggling with in the social media and digital space right now is everybody wants to be an expert on
Mhm, mhm,
everything.
mhm,
Can
mhm.
I say
Yep.
that without getting
Yeah.
in trouble?
It's true. It's true.
And you can wear a lot of different hats, but I think everybody I think that we're sort of struggling a little bit, and it almost ends up sounding and feeling like people are competing with each other, even
Mhm.
in the science communicating space. And so I don't know. I'm struggling with
Yeah.
that a little bit right now.
There's definitely work to be done, but it's more like
Yes.
sharing each other's expertise instead of pretending
Yes.
to be experts in everything
Yes.
that we do.
Yes.
Yeah, which is
Exactly.
the way to go.
Exactly.
Yeah.
Yes.
So let's fine tune on your one of your
Yes.
expertise for today,
Yes.
food allergies. And for those who are not familiar, what exactly is a food allergy in simple terms?
So, in simple terms, food allergy is a very specific immune response to an allergen, which is basically something that your immune system recognizes as dangerous. And then it has a series of events that happens on a cellular level that cause the symptoms that we often can see, like itching and hives, swelling, coughing, vomiting, things like that. It can be an allergic response can be to anything. It can be to like tree pollen or dog dander or peanut or shrimp or bee venom. It's a very specific cellular response, and food allergies are mediated by again, I keep harping on this, but it's a very specific mechanism, and it's different from like a food intolerance or lactose intolerance or gluten sensitivity or other food sensitivities. And I think that's the distinction that needs to be made. That not all adverse food reactions are food allergies.
Right. Right. And that helps a lot. And we'll discuss this, I'm sure, further down, but it helps a lot with also restrictions, but also to be aware of how you identify the allergies and how you manage them and so forth.
Exactly. Exactly.
How common are food allergies common? And in children, how common are they? What are the top food allergens that people, hear about? And is it as common as there's a
Yes.
lot of focus on food allergies lately.
Yes.
So,
Yes, it's pretty common. Like even if you think you don't know somebody who has a food allergy or a child who has it, you probably know somebody. So I think the statistics in the U.S. right now are 1 in 10 adults and 1 in 13 kids. So at least a couple kids in a classroom. If a classroom has like 25 to 30 kids, will have food allergies, and that translates to like millions of kids and adults that are managing this condition. So it is very prevalent. And I think sometimes the narrative around food allergies and management, like the way that a lot of people hear about it is like, oh, well, my kid goes to a school that's nut free, right? And that's their first interaction with it. Or they're in a daycare or a camp or something like that. And then you sort of have to learn on the fly. And a lot of times you're being educated by other parents that are in that scenario and trying to navigate all those things. So sometimes it's not that your kids have it, but you're hearing about it because of daycare or school or camp or something like that.
right. What are the common symptoms of a food allergy? You mentioned some before, but what are things to look out for? And also, I love this. You focus a lot on the fact that this is a spectrum, of
Mhm.
course. So if we can have a little bit of a discussion on that, I
Yeah.
think it's important.
Yeah. So I think so what we hear in the news, what we hear online or from the neighborhood support group or something like that, sometimes is in stark contrast to what allergists are actually talking about and how we're talking about it in clinic, right? So even with food allergy reactions, they can happen on a spectrum. And not, I think what I should say is not every food allergy reaction is going to be the worst the next time you're exposed. That is a myth that I wish would just die a violent death. Like I hate that people think of it that way,
Yeah.
because there are so many other factors that influence the severity of a reaction. And one of the big ones is how much have you eaten? And everybody's reaction, everybody's threshold to have an allergic reaction is going to vary a little bit. And unfortunately, we don't have good commercialized, available, accessible testing that helps us figure out, well, like for, little Timmy, it's going to take 30 milligrams of peanut, but somebody else, it might take like 1,500 milligrams of protein, right? And so I think everybody ends up just taking the worst case scenario, which is you are very, very sensitive to even trace amounts. And then that's the narrative that we build on. And I try to undo a lot of that because in clinic with my patients, because it is very stressful, right? I mean, we hear about it even with like simple things like traveling. And people are like, well, I'm not going to travel. I'm not getting on a flight, even though we know that peanut protein is not aerosolized. It's not going to run through the cabin. Your risk of having a severe allergic reaction to a bag of peanuts opening is very, very low. But it's just the narrative that ends up coming along with some of these diagnoses. And I forgot to mention the earlier part. So the top allergens in the US are milk, egg, and peanut. Those are the top three. And then tree nuts like almond, cashew, pecan, hazelnut, and then wheat and soy and fish, shellfish, and sesame just got added few years ago. So
Right.
those are the top nine. And across the world, this will vary a little bit depending on sort of what's in the diet and what more regular exposure is and things like that. But in the US, those are typically the top nine allergens that we think about.
Yeah. And you see diet shifts, like in Cyprus also I see this, allergies tend to become more, what you would expect in the Western diet,
Hmm.
because, you see how, dietary patterns and food choices are changing, of course, over
Yes.
time,
Yes.
definitely.
And it's almost like our immune system catches up and it's like, wait, I'm gonna have an adverse reaction to this, you know?
I'm gonna give some heads up.
Yes, yes,
Yeah,
yes,
yeah.
exactly.
And how do you typically, uh, how is an allergy diagnosed? And I think that this is an important question and a tricky one, because there's a lot of non-validated tests out there, which I'm sure you're
Yes.
fighting like a lot, to inform people. So what is the
Yes.
typical testing?
So the clinical history is the
Hmm.
biggest piece of this. It's what has happened when you have eaten the egg or the soy or the wheat. That is what helps me figure out which bucket of an adverse food reaction is this going to be in. And if you tell me, I'm picking on peanuts, but let me use something else like dairy. Let's say you have an IgE mediated. The IgE antibody is sort of what mediates a lot of these allergic reactions. If you have that type of a reaction to cow's milk, usually symptoms start pretty quickly within 15-20 minutes. Sometimes it takes an hour or two, but they start to creep up pretty quickly. And you can get some like lip tingling, lips swelling. You can get some mouth scratchiness. You can get nauseated. You can have vomiting, diarrhea. You can have hives and itching. You can also have coughing and sneezing. So literally all the things that we hear and see about with the classic allergic reaction, you can have any host of those symptoms. And it doesn't mean that you're going to have all of them. It just, the goal is always to be able to recognize when you've had an accidental exposure or your child has had an accidental exposure, and then to take the next steps appropriately.
Yeah, of course. And that's why it's important to talk to a healthcare professional when you have, these worries, and
Yes,
yes,
yes.
rather
So
than,
the
do panel
yes.
testing or anything of
Yes.
that
Oh my
sort.
gosh. Yes. Like don't do some crazy hair
Hair
testing. That's not
testing.
validated. The IgG, the food sensitivity testing that's marketed is not validated. It's actually
Right.
quite useless. It just shows me like, great, your immune system has had an appropriate response. It works. But those tests are very expensive. They can be
Yeah.
several $100s. And it's really frustrating for me because I know parents and patients are looking for answers, but sometimes these companies will take advantage, right? And then you've wasted all this money, and it doesn't necessarily help you get on top of your symptoms. Even if it's not a food allergy, even if it's food intolerance or food sensitivity, none of those other tests that are being marketed are validated, even though they are commercially available. So the number one thing that I look for is what has happened when you have eaten that food, and then we can talk about testing, whether it's skin testing or lab testing. But the only way that I know how to interpret those tests is when I put it in the context of what has happened with that person.
Right. The response to that food, of
Yes.
course. Yeah. And because it also, if you don't get the right diagnosis, it can lead to over restriction and,
Hmm.
fear and all that, which, obviously can have an impact on quality of life and everything else.
Yeah. And the other
Yeah.
thing that I worry about in young kids, if we're unnecessarily eliminating fruits from their diet, it's overall growth and nutrition, right? I've had kids that have come in and they're avoiding like dairy and egg and soy and a lot of different things, and then they're malnourished, right? And so
Right.
then we have a lot of work to do to kind of get them to catch up and reintroduce a lot of these foods safely if we can.
Right. Of course. Makes a lot of sense. What is the treatment to manage an allergic reaction or an allergy in general?
Yeah, so generally, the standard of care for a food allergy has been you just avoid the food and you carry your emergency epinephrine and you recognize, and you should be able to recognize symptoms if you have an accidental exposure, and then you follow your emergency action plan and be comfortable with when to use medication.